Welcome to our TED Talk. I know we've done this before, but you might have missed the first one. I'm eating my breakfast, okay? Melon. If you haven't tried the hammy melons, oh my god, eat them. Hammy, H-A-M-I. Oh, size of a watermelon, small watermelon. And they're only $4 each at Costco. I bought 2 at a time and they'll be gone in a couple days. It was also over 100 by 10 a.m. here. So, we live on melon. Okay, so we're going to have our TED Talk. Miss Vet Assistant doesn't understand reproduction, her own conditions, or her body. But let's hear from her first.
I'm definitely cramping. It's happening. It's like down in here where I feel the cramping. Like right in here. And it's like pressure. And then my lower back is, oh my word, this is the worst.
Typical cramping.
I feel nauseous. That's not from ovulating. It's the adenomyosis. What does that fucking mean? I'm not supposed to get my period. Not now. Yeah. How do I have that? I need that. I know. Ovulation shouldn't cause discomfort. No? Not even with the Clomid?
No?
With your hormones. I don't have any crackers. It's the uterine muscle contracting. I took Clomid and it didn't hurt. I absolutely had the cramping during ovulation. Ovulation caused me discomfort. I have endo also. You can hyperovulate, which causes pain on both sides. Ovulation can definitely cause discomfort. Uterine. The uterus. Can we just call it the uterus?
Jesus.
Let's all go back to biology school.
Please, let's.
I'll be the teacher.
Oh boy.
Okay, I'll be the teacher. This is how I would do the class. Okay, you guys ready? This is how I would teach you guys.
I want to see a picture.
Okay. Here, I'll give you guys a little bit of a show. Okay. I'll make you guys laugh.
All right.
Hold on a second.
Oh, we'll laugh.
It's gonna be funny. Okay. Oh man. What am I fucking doing?
Is she 13?
Okay. Here we go. Okay. So, we're gonna have a little demonstration today in class, okay? This is Biology 101. Okay, so, here we go. This is my way of explaining it. Okay, so the women, we have a uterus, and it is shaped like a U, okay? I hope you guys can see that. Okay, and then, in order to have a baby, and when you have all the problems that I have, you have endometriosis, which is the inside of the uterus,
Wrong.
of the little tissues here
Wrong.
And then the adenomyosis is the outside muscle of the uterus surrounding the uterus. Okay, so it's like a PB&J. Okay, so the PB&J is the jelly's inside and the peanut butter's outside. Okay, sounds good. And then when you try to get pregnant, what happens is the sperm tries to go into the uterus, and it's the adenomyosis stops. It's like, no, you're not going, so it goes back up and around, and then you get your period, because it doesn't go in.
She doesn't understand the female body. She doesn't understand reproduction. And that is a bowl of ramen. Shouldn't even remember she has a cervix. Does she know where her cervix is? Now that I've eaten half the bowl, I'm going to get rid of this real quick. Hold on.
Is that good? If you heard whining, it's because she saw me eating melon and I wasn't getting her any. Because we had so much melon the other day, we got the shits. Yeah, and that's hard when you have trouble walking. Yes. So, you got your piece of melon. Yes, you did.
We have our handy dandy Chef Carl pointer stick. First off, endometriosis. Gabby, please say it slowly. You have a tendency to rush your words. And then you get tongue-tied, okay? Endometriosis. That is endothelial tissue that grows outside of the uterus. It can attach to different organs. It can just cover the ovaries, the tubes, your uterus, your cervix, but it can also cover bladders, colons, and small intestines. I've seen it where it's grown on kidneys. It can grow anywhere. The abdominal wall. It is a very rapid growing tissue. It tends to feed off estrogen. So if your hormones are unbalanced, you tend to have more problems. They can try and balance it with birth control pills. It does cause pain and cramping. It causes painful intercourse and infertility. Usually you diagnose it with a laparoscopy. Sticking the air in, moving the camera around, checking it out. Your other condition is not 100% diagnosed because it can only be 100% definitively diagnosed on hysterectomy. But you never say it right. So let's say it slowly. Adenomyosis. Adenomyosis, not however you say it. It's bizarre. Adenomyosis. I'm sorry, my small assistant here is trying to assist. Stop, sir. Now, before we go on, let me just say, I am not a nurse. I am not a doctor. I am a lowly medic with 20 years on the fire department, 13 years in an acute care, ER, and ICU. That said, I have seen my share of things. I have seen my share of textbooks and classrooms and spent thousands on my education. I didn't take loans. Didn't take loans at all. Not even for UCLA or Pierce College. My first degree was in animal nursing through Pierce College. That was 2.5 years. And then I went to UCLA for something completely unrelated. I became a firefighter medic much later, after I was a sheriff's deputy for a year, which I hated. I've told you guys that one. No little assistant, no No, he loves the Chef Carl stick. No, smell my finger. A little spinal tap moment. Smell the glove. All right. Adenomyosis is endothelial tissue that grows inside the uterine wall. Okay, not inside your uterus. We're going to get to this, but inside the uterine wall. Would you stop, little assistant? It causes increased bleeding during your period, increased cramps, and pelvic pain. And like I said, you can see it on an MRI. You can see it somewhat on ultrasound. Definitively, it can only be diagnosed on hysterectomy because they have to take the uterus out and actually microscopically slice it and look. Both can be managed with medications. Both cause similar symptoms and both cause infertility in people. Would you stop, little man? Stop. He really likes this stick. Look, here he comes. You're blocking my diagram, sir. Here's your toy. Here's your toy. Chef Carl's getting your toy for you. Okay? Here you go. Here you go. What you got on your face? Oh, God, here comes the other assistant. He wants the toy. Go get your toy. Go get your toy. Okay. First mistake she made was drawing a uterus like a bowl of ramen. Our openings are down. Always do it anatomically correct. When you're going to draw a body part, do them anatomically correct. Outside world. Oh my God, I'm going to put him away. One assistant down. Sir, do you want to go join him in the bedroom? Do you want to go join him? I see you. I see you. Okay, that's enough. That's enough. Let Mama get through. All right, so we're going to draw it anatomically correct. Here is our cervix. That is what this little hyphen is. Oh, you'll hear my assistant howling. Hear him? Hear him? So we have our cervix, right? Oh, we're going to leave it open because we want to show that sperm goes in. See? Not a bowl of ramen. Not a bowl of ramen. Okay? It's the Ford symbol. Isn't it the Ford symbol? Yeah. No, is it Chevy? Which one is it? The Ram. It looks just like the Ram symbol. Oh, I can't remember. It's the car thing. I had a teacher once that used the actual car symbol. Oh, now I gotta find it. Yeah. See? Now, I've drawn mine bigger because I want to show you something, but we'll go back to that. All right. So, here's your ovaries, right? Here's your fallopian tubes. They're not joined. They're not connected. Okay? That's a myth. That's a myth people don't understand. Here's your ovaries just floating out there. Like two orbs in the wind, but they're not blowing around. And then your fallopian tubes have almost like antennae, like if you've ever seen a moth, a male moth, and his big, giant, fuzzy antenna. Or like a flower with a bell. It just hangs over, and the eggs pop out, and the fallopian tube, because of the way they're shaped, it sucks in the egg, okay? And then the egg is deposited inside. It is connected here. Now here's your bladder with your little ureters going up to your kidneys, and this is your urethra. Bladder, okay? And here is the uterus, and you notice it's thick because it is a giant muscle. It's just like our heart. It's a giant muscle that expands for a child and contracts after your child. So here, it's a crappy diagram because I'm running out of pens because my assistant takes them and hides them places. Or he takes the caps off and they dry out to death. Okay, so here I have taken a cross section, right? Here's the inside of the uterine lining. Here's the outside of the uterus. Okay, the myometrium. Ooh, because it is a giant muscle. She understands that. Gabby, I know you do. The tissue in green on the inside wall is the tissue that is sloughed off, which is called menstruation. Every month, A woman builds up tissue along the outside of this wall, the inner wall, okay? And then if an egg is not implanted into the uterus, if there is no pregnancy, then this tissue in green sloughs off. Bloop, comes out. It is sterile when inside, unless you have a condition going on. And then as soon as it hits air, just like urine, bacteria grows. The inner wall, okay, is muscle fiber. Those are muscle fibers. Uterine muscle fiber. Fiber cells, okay? The pink all over here is endometriosis, which is growing on the bladder. It can grow on your ovary. It can grow on the outside of your uterus and cervix. It can grow on your tubes. It can grow everywhere, right? But sometimes the endothelial tissue will grow inside the muscle fibers. And that is adenomyosis. That's why it's nearly impossible to 100% diagnose without having a hysterectomy. You have to do a cross-section slice and look to find it. They can see signs of it. They can, from your symptoms, try and say you have it. They can only definitively say you have it with a hyster. That said, look at the symptoms. They're all similar. So what are the odds? Okay. Now, she had an embolization coil placed that generally repairs heavy bleeding, fibroids. It's starving the blood supply to a certain condition, endometriosis. It can help with the adenomyosis. You're trying to not give the tissue, this endothelial tissue that's gone bonkers, you're trying not to feed it blood. So the problem is when you have a UAE or coil embolization procedure, one of the side effects of it is infertility. So she's at a big disadvantage. If she has both these conditions and had a coil, she's got 3 strikes against her. And when you starve certain tissues of blood supply, there's collateral damage. So the odds of her getting pregnant without medication are pretty slim. Now, of course, we all know she's taking medication. Will she get pregnant? Anybody can, sure. It's just if the planets are aligned right in her case. She doesn't treat her body well. She doesn't eat a balanced diet at all. She doesn't get enough exercise at all. She doesn't do any cardio. Cleaning your house is great exercise, but you need to raise your heart rate for 30 minutes or more. You need to break out in a sweat, be uncomfortable, and it has to be aerobic exercise. And she doesn't do that. She needs to de-stress. She needs to stop focusing and obsessing on getting pregnant. How many times have you heard of people that stopped trying, stopped IVF, adopted a child, and boom, got pregnant? There's a reason for that. Cortisol levels prevent you from getting pregnant. A poor diet can cause difficulty in getting pregnant. So she's not treating her own body in a way that would assist it in getting pregnant. The Adderall is a huge problem. That baby will be born addicted. Psych meds, though necessary, are also a problem. Sure, babies can be born without problems when when a woman is on psych meds, but oftentimes their blood levels show quite high levels of SSRIs, and that causes some developmental problems. They're now wondering if there is a connection between autism and SSRIs in some cases. So, it's not a ramen bowl. She's not a biology 101 teacher. I seriously doubt she took biology in homeschool. And I would worry, and I'm not saying anything to be insulting to anyone who is religious, but considering Mimi's beliefs, I would worry about her sex education. I really would. I think Mimi was kind of a parent, a guardian who told the bare minimum and sugar-coated it in a Sunday school way and expected the kids to figure it out themselves. But much as she doesn't like saying it, uterine is the proper term, and it's not upside down. Not a ramen bowl. It's this simple. Call me stupid. Oh, it's a Dodge. That's it. Dodge. Sorry, guys. Stupid. The Dodge symbol. Yeah, I had an instructor who used to use that. But you can see here how muscular. I mean, this is a huge muscle. Huge. And it does expand quite a ways. Now here it looks like they're shoved, the ovaries are shoved inside the tube. They're nestled right up against it. They're not inside the tubes, but they're nestled. There's a separation here. So you can't see it when I blow it up, but there is a separation. But nonetheless, this is the proper way to draw it. And we don't giggle. We're not 13, Gabby. We can say sperm and vagina as adults, especially adults that have children and will one day have to teach their child about sex ed. Don't leave it to the schools. And don't wait until they're too old. Okay, that's your TED Talk, and Chef Carl's pointer stick will be leaving now for the assistant. Smell the glove.